I am so excited to have both of you with me today and to discuss this important topic of mental health integration. We have Melissa Merrick, who's the Clinical Director of Brief Intervention Services of Behavioral Services Division at the South Central Foundation. She's an LCSW, MSW, and CDC. Daryl Toll is the Executive Vice President of OneMind. He holds a bachelor's degree or bachelor's of science in business administration, accounting and finance from Walla Walla University, and a master's in healthcare administration from Loma Linda University. And I'm Daryl Moon, the CEO of Orient. I have a Master of Health Administration from Brigham Young University, and I've spent years both managing hospitals as well as managing population health services. So I'd love, Melissa, if you would just introduce yourself. Talk a little bit about your position there at South Central Foundation.
Sure. So hello from Anchorage, Alaska, South Central Foundation. We are a healthcare system that provides full integrated healthcare, medical, dental, behavioral to the Alaska Native American Indian individuals living in the Anchorage area. So my role at South Central, I've been with South Central for about 15 years, all of which has been spent focusing on integrating mental health or behavioral health. And when I use the term behavioral health, I'm really combining the concepts of mental health, so behavioral change and substance use. So integrating behavioral health into our various medical settings. So we have integrated behavioral health in all of our medical clinics, from primary care, pediatrics, OBGYN, women's health, as well as our hospital and rural community health centers. So really focusing on the idea that everybody should have access to behavioral health, just like they have access to medical care, same day, when you want it, when you need it, for any issue that you really need to discuss.
Great. Daryl, introduce yourself.
Hi, everybody. Daryl Toll. I am with OneMind and specifically focused on OneMind at Work, which is integrating mental health prevention and support into the workplace, the one place we all gather on a consistent basis, can either help us or hurt us relative to our experience of the mental health continuum that we're all on. So as we gather in the workplace, OneMind at Work focuses on how the workplace builds a culture that reduces stigma, how the workplace creates a work design that is protective instead of risk creating, and how the workplace creates access, like Melissa said, to services and support that are essential, both virtually and in physical network locations, just like you can get in your physical health services associated with the workplace. We also want to impact dinner table conversations because the parents are at work. So as organizations often focus on schools and teachers where kids matriculate and eventually leave, we have a stable place where we can influence parents who can go home, look for early symptoms, and look for ways to talk about mental health in a way that destigmatizes at home. So we think there's too much stage 4 mental health care available, which would be really unfortunate if cancer or cardiac disease were treated that way, and not nearly enough stage 0, 1, 2, and 3 mental health services available. And we're trying to partner with people like Melissa and workplaces all over the globe to address that issue.
Very good. And you know, when you think about mental health and you think about it as a risk factor, the Health Enhancement Research Organization many years ago did a study and found that of all the risk factors out there, nothing even compares to depression and uncontrolled stress. They are the number one biggest risk factors that create costs in all areas of healthcare, far more than not eating right or not exercising or alcohol consumption or tobacco use. You know, we often think that those are the big ones, but truly depression and uncontrolled stress are the biggest risk factors. And what's incredibly sad is that people with mental illness symptoms often wait 10 years before they reach out for help. And like Daryl said, that's incredibly important that we get in front of that, we reach out more quickly. And then almost 60% of those people never reach out for help. So if all we ever do is say, well, let's help the people who reach out, we're missing a huge part of the problem. And those people aren't just suffering from mental illness and the pains associated with that, but they're also suffering from all of the other conditions that are affected by their healthcare, that mental health risk. Melissa, I'd love for you to describe, and I love the model that you've built, how you've integrated behavioral health, and talk a little bit more about the fact that it really is both helping people change behavior, and I love the fact that your entire healthcare system, I think it was Dr. Evie that said, it's a behavioral health model. We built a behavioral health model of healthcare. And talk a little bit about how you address both behaviors and lifestyles, as well as how you integrate the mental health portion. Talk a little bit about the staffing and how you do that at each of the clinics and your primary care team, and how they're assigned to people, and how you then wrap around those other services.
Absolutely. So at South Central, we refer to our patients as customer owners, and I want to start there because it's a really important just language shift. Our customer owners own our healthcare system, so they provide us consistent feedback into what's working and not working. And when we move away from patient, which has this top-down feel where I am the expert and I know what's best for you, and we move into more customer owner, where we're providing a service and we want you to decide what services work for you and don't work for you, we open up more of a conversation. So all of our customer owners are impaneled to a team, and that team consists of a medical provider, a case manager who's usually a nurse, a scheduler, and a medical assistant. And then we have also available for every team a behavioral health consultant. And so in our medical clinics, we have what we call kind of targeted ways in which we try and connect with people. So that could be through routine screenings or conversations that we want to check in with yearly around mood, stress, sleep. Sleep is a major area that we talk to individuals about, and often reflective of stress or something larger. So we have some targeted ways in which we try and connect with people, and in doing so, really opening up the conversation that your emotional wellness is just as important as your blood pressure or cholesterol. But then we also allow flexibility to all of our teams to pull us into a visit real time, same day, whenever the provider or any one of those care team members feels like it might be helpful. So when we started this journey about 18 years ago, many providers didn't know how to use us. Customer owners were confused about, why am I talking to somebody in primary care about these things? And now customer owners will call and say, I'd like to talk to a BHC, or I'd like to talk to somebody about sleep or stress. So they don't even need a referral through their primary care provider. We also really try and highlight areas where we're focusing on behavior change. I like to say that every one of us has an area in our life where we could make some changes to our behavior. So whether that's increasing an area or decreasing an area that would promote overall wellness for us. So it could be talking with someone around barriers to consistent exercise, or really talking to an individual about difficulties they might have in terms of taking their diabetic medication. So it doesn't necessarily need to be this mental health focus. It can be about behavioral optimization and helping work to create healthier behaviors. And I just want to say really fast, I loved what both of you said about the trickle-down effect of stress, because we understand certainly that stress at any level impacts all the way through the family unit, all the way through the family system. And so stressed adults create stressed children. And so if we can really identify and treat the entire family and open up these conversations from a very early age, we will create healthier families, healthier individuals, and healthier communities.
And if you would, talk a little bit about the storytelling, and that's such a fundamental. I love the fact that your entire healthcare system is a relationship-based healthcare system. Why is that relationship so important? And how do you use storytelling to build that trust?
Absolutely. So relationships are the fundamental basis of our healthcare system. Our operational principles actually spell out the word relationships, and every change that we put forward, we balance against those operational principles to make sure that it's a relational-based system. And part of how we engage in relationships is really listening deeply to the story of the individual. So we like to say that there's a story behind everyone's eyes. There's a story behind both of the Daryl's eyes that are on this call with us, and really understanding what it is that makes up who the person is. And that requires time to listen to the story. And sometimes it happens over the course of years. Other times individuals come in and they really want to share openly about who they are. That includes their family unit, how they were raised, what influences they've had in their lives, etc. But in doing so, we have found that people are more likely to open up, engage, and partner with us to create a plan that works for them. We don't want to be the ones that say, this is a protocolized plan that works for you. And in order to be most effective, we really need to understand their story. So we send all of our staff, whether you're an administrative front desk staff to the director of a division, through a 3-day training called Core Concepts, which really talks about the value of communication skills, how to respond to story in a way that's helpful and healthy versus not helpful, or tapping into your own story and minimizing somebody else's story. So we spend a lot of time up front in the organization to really make sure people understand the value, but also give them tools that are effective in working with customer owners at any level.
Nice. Daryl, talk a little bit about your organization's focus on company culture and, again, building that relationship and building that trust to move upstream.
Yeah, and it really involves storytelling as well. You mentioned a statistic, and the most recent statistic I've seen is that 63% of employees would not disclose a mental health condition to their employer. They want their employer to rate of 90% to provide support in a safe environment, but they don't feel safe today. And employers think they're doing really well. 71% of C-suite members think that they're good or very good around mental health support. And 27% of the front line think their company is good or very good. So the blind spot is huge in companies. And it starts with relationship, it starts with storytelling, and it starts at the top. No one will feel safe until they realize the CEO and leadership is willing to be vulnerable and open on the topic and create safety. So one of the first things we encourage is that leaders tell their stories, either their personal story, they tell their a family story that they feel comfortable telling. We always tell leaders we're in a perfect moment right now because everyone's been through a global pandemic. So don't say you don't have a story. You have a story. You've been through a global pandemic. I'll bet you've even cried. One moment in the dark of night, you hit the wall during this pandemic. Tell people the pretense of perfection doesn't do any good for struggling people and organizations. So open up. And as they open up and start talking about things, it allows for a company conversation to take place that then leads to a sense of safety and a sense of an organizational opening up, as the case may be. And once that starts, there's a bit of a downhill roll that starts, the flywheel starts to turn, and people start to talk about their coverage not being what it should be. The fact they don't have a protective work environment, they don't have supportive supervision, and it creates some good pressure in organizations that become safe and open in that way, and it does. It starts with stories, it starts with relationships, and then from there you've got to go build some real structures that are helpful to people and that emphasize that reality of the safety of my work environment. I was one of those people. I was in the 63%. I had a story that I didn't tell my organization for a couple of decades. College, I had an anxiety disorder diagnosed. I got therapy treatment, hid it from my friends. I didn't tell my employer. I grew in my job, was very functional and capable, but struggled privately at times and did not disclose it, did not describe it. And when I did, I saw the impact on the organization for the good. And I saw the organization open up. So I know this is true. It's real, and it makes a big difference.
Well, and we found in managing population mental health that one of the most effective things we can do is partner with that organization and be there in front of employees, having conversations on these topics of life. And it's a huge array of topics: financial struggles, raising children, dealing with teenagers, relationships between spouses,
Right.
frustrations at work. There's so many topics that if you'll bring to the workforce and you'll have those open conversations on a regular basis, people go, oh, it is safe and there are resources. And yes, sometimes I get so busy with life that I don't realize that I could use some help. And that's one of the most important ways to get people to address their problem early, is to make it safe, build relationships, and address those issues.
Well, and it sneaks up, Daryl, on other big problems.
Yes.
So we know of an organization that started a collaborative care clinic. It's not dissimilar from what Melissa describes, with primary care and behavioral health services embedded and a full support system in place. They diagnosed more diabetes in their collaborative care clinic designed to support behavioral health than in their diabetes institute in this health system, because the things that people are struggling with from a mental health continuum perspective are deeply related to other types of healthcare struggles, inclusive of very serious chronic disease.
Yeah, I just want to say thank you, Daryl, for sharing part of your story, because I think it's illustrative of what we've been talking about. We're humans, and part of stress and going through the human experience is experiencing a variety of emotions and a variety of different challenges in our life. And so if our starting place is understanding that as part of the human experience, we are going to have challenges at time and joyous times in our life, and we lead with that rather than leading with a what's wrong with you approach, we're going to definitely be more successful. And so part of what we have done is really build in a tiered approach to helping support customer owners. So in addition to the training of core concepts, really building the skills around mentoring. So within our workforce, creating a mentoring workforce so that we not only create space for our employees to share what they might be challenged with, but also continually refining those skills to be able to work on how we partner with somebody. Because I might think I know what's best for somebody, but getting that supervision and having that conversation can really help me look at the customer owner story in a different way. And that continuous kind of encouragement to go back to the story to help them create their own care plan.
Nice. Daryl, talk a little bit about, your experience. You've been in this industry for a long time, even before you joined OneMind. Talk a little bit about the importance of having the entire team be sensitive to this influence.
Well, if you think about the way traditional healthcare systems approach care, first of all, individuals have been sliced into component parts, and training has been highly specialized. So this kind of global picture of an individual that's really a network, right, that's coordinated by our brains, starts to fall apart when people focus on my pinky finger and my kneecap. So we get split apart, and we feel that split in the way healthcare is provided. The second thing that happens is that for various reasons, the financial picture around the pinky finger, the kneecap, and the brain become very different from each other. And there is a money chase. People do the services that can make the largest margins or profits. In many health systems, those become king. And that's where the focus is, whether or not they're at the center of how we function as human beings, or whether they're very peripheral, but just very profitable. That's a second dynamic that's real and that's at play. The center of our network, our brain, is an area for various reasons other than surgical intervention that brings in almost no money. And so organizations who are in the middle of an economic model are disincentivized from dealing with the part of us that coordinates the rest of us. And when that's the case in a health system, you are starting to carve out the brain just like you carved out dentistry and eye care years ago. And all of a sudden, people are wondering why I can't get whole person care in this place. They may talk about it, their pamphlet may talk about it, but it's not really happening because of the way that in many countries, not just North America, the incentives are built. And that leads to the popular courses in medical school and where the brightest minds go and where the entrepreneurs function and where the big ideas come from. They don't come from places with very little support and very little money. So it takes extra amounts of effort and an extra fight to do what's being described here. And it takes true altruism, a sense of purpose, and a belief system, not just a business mindset. And it certainly takes understanding a human being and how we're designed and how we function, and a desire to take care of that comprehensively. So there is a significant gap from the incentives and the structures of healthcare systems that most people interact with in their communities and the way a person is best cared for. Another thing that is a tough reality is we rely a lot on asking people to do a long list of things and expecting them to do that long list of things without really knowing if they have a sense of support or the capability financially or socially, intellectually, geographically to access the things they need to actually do those things. We don't wrap around people enough. And we ignore our responsibility to create passive environments, whether it's the way work is designed in a workplace or the connections people have with other people, the way that they have a sense of purpose and meaning in their life, various ways that people function best aren't built naturally into their environments. There are ways people can do nothing and still be benefited by the interventions of leaders in workplaces, leaders in a health system, because there's a design that helps them naturally, even if they don't lose 20 pounds. Even if they don't do what we recommend, they can still be better because of the way we design our work and our environments. And I think all of those come together to really the demand that something new is needed and that it takes each of us, from the street level work in organizations that we do to the work Melissa does and in healthcare systems around the world, really coming alive to how that happens and then how individuals interact with it.
I'm so glad that you talked about the need to integrate and that really there is a sole person that's in the middle that all those other parts are connected by. Melissa, talk a little bit about how closely your physicians and those BHCs work in tandem and how those BHCs are available. They're not taking appointments a lot of times just so that they can be brought into a visit.
Absolutely. I'll just say really briefly, one of the things I love about integration, no matter what it is it pushes on the system to continuously evolve and change, because all of a sudden you're dealing with complex things that were easy to ignore before and we can't ignore them. And so in our setting with behavioral health integration, we are working alongside the medical team. We're sitting in the same area as they are. We do not have our own offices. We share our charting, and most of the schedule is available real time, so we can get pulled into a visit same day, right when it's needed. We would also sit with the customer owner, often in the exam room where they've just been seen, so we're not asking them to move to a different location. And following up with the provider. Sometimes there may be a specific question. Melissa, should I start this person on antidepressants? Sometimes it's more, I'm not sure exactly what's going on, but I'm worried about this customer. And so we often try and answer whatever the consult question is. But once I'm in the room with that customer owner, I'm really driving what's the work that they want to do. But what they know and what they hear is, I'm part of your healthcare team. I'm not somebody that you have to go to another building. You can call and come see me anytime. And so we do see follow-ups. And through our follow-up visits, determine, is this level of care what works for you? Or do you want something a little bit different? What I love is that, we see people over the course of their lifetime. In our relationship setting, I will get to know customer owners and their children and their family members. And so when life is stressful or when it's really exciting, we get to hear about it. And they get to know that in addition to their provider, their medical provider, they have a mental health, a behavioral health provider who walks alongside them and is available at any time.
Nice.
Well, another thing, if I can comment, Melissa, is that environment destigmatizes the visit, because you can be there for any reason. And it's not that feeling of walking into a specialized location where if someone spots you, they're going to start wondering, why are you there?
What are you doing there?
It's the place you go for all kinds of things that you might need. And that's a big deal.
It's a huge deal. And when I started this work, I came from a more traditional outpatient therapy background, and I was amazed what people will share with you first time you're sitting with them, because you're building on the trust that they already have with other team members. And so if the provider brings me in, the customer owner often knows, okay, it's an okay person to share a little bit with. And that destigmatized environment, I like to joke, like when I've gone to therapy, even sitting in the lobby thinking like I should leave, we're able to capture on readiness right then and really understand what those barriers are, and that you can talk about these things in your doctor's office. It's okay. And children growing up being able to have connection with us, showing that it's okay to be able to have these conversations. It's not something that needs to be stigmatized.
Nice. Melissa, I know that the NUCA system of care has done some really neat things about peer support groups and huddles. And I can't remember the term that you used, but talk a little bit about what you've done for years at getting like people together to help them and support them in their struggles.
Absolutely. So learning circles is our kind of word that we would use. And several years ago, we were really looking at our access to behavioral health and getting feedback from our customer owners. And so one of the ways that we tried to increase access, so have more of a population-based access, was really create and deploy a variety of learning circles. And so most of them are peer-led, led by an individual who is either an employee or a community member that says, I want to run this learning circle. Some of them might be a little bit more clinical in nature, meaning you're enrolled in a specific program, but the bulk of them are available to anybody, both SCF customer owners, employees, or even community members. And so we could have learning circles that could be a yoga class. It could be a beading or drumming class that builds connection and cultivates conversation and relationship. We could have more of an educational learning circle like Anxiety 101 or recovery management and prevention. And so the learning circles through the COVID journey, we really challenged ourselves to run them virtually. And so we've been doing that and have actually found amazing success with both virtual learning circles as well as in-person learning circles. So it's just been a nice way to offer a different level of support that, again, is open, it's non-clinical, there's no charting, people can come in when they want, and no assessment needed.
In your case, these people aren't all working at the same place. Your membership is spread across many work employment environments. And so what are some of the things, and clearly the learning circles probably help with this, but how do you stay in touch with people on a regular basis, especially those that may not be managing a chronic condition and are just kind of out there? What are some of the things you're doing proactively to engage those people?
Absolutely. So a couple thoughts. About half of our workforce here at South Central are customer owners. And so one of the ways in which we receive feedback is through our workforce. And that could be ideas about outreach. It could be ideas about different things. But every customer owner who receives care, whether they work here or not, is impaneled to that core team. And so by having the same primary care team, we get to know people, and we might know, hey, I haven't heard or seen from them in 6 months to a year. So we might do proactive outreach. That might be a phone call just to check in, a phone call to ask that they come into the clinic. But we also do a variety of community listening posts. So every year we hold, this was pre-COVID, hopefully we'll do it again next year. We rent out one of the big kind of convention areas in downtown Anchorage and have a gathering where we have some fun activities and as well as an opportunity for customer owners and community members to learn about our services. And so we advertise that. We do, of course, a lot on social media to reach people, and then some different kind of publications, newsletters, where they're mailed, email or paper, to every customer owner's address if they're impaneled and eligible to receive care here. And that would include some educational things. So we just, May was Mental Health Awareness Month. We did a big article in our Anchorage Native News on the importance of mental health, especially in the pandemic. So we have a lot of different ways in which we outreach to customers. And I just want to talk for just briefly around the employee support, because one of the areas, I'm just speaking to Daryl's world, healthy employees create healthy healthcare providers. And so we've spent a lot of time and attention to make South Central Foundation an amazing place to work. I've been here 15 years and there's a reason for that. And we have a lot of longevity in our employees. So all of our services, the learning circles, the behavioral health consultants, we also make available to our employees. And we emphasize story not just with customer owners, but with your coworkers, getting to know how teams work together and what's going on with team members. And then we also offer wellness leave. So weaving in wellness leave that an employee could use for going on a walk or exercising. So really trying to weave in a culture of wellness and knowing that that is another way that we outreach people because we're creating healthier employees who then can have conversations about in the community, SCF being a good healthcare provider, but also a good place to work.
Nice. And Daryl, other ideas or thoughts that come to mind for you that you've seen used to, again, get upstream and proactively stay in touch with people?
Yeah, absolutely. The importance of qualitative surveying at a large scale is, I don't think should be understated. It's hard to get to every individual and really get to the level of understanding of them across millions of people. Our members represent 10 million employees. So there has to be some scaling to insight building as well. So one of the things we recommend is that we don't just do engagement surveying in our organizations, but that we add some questions about mental health support, the personal sense of struggle or thriving, and the view of the organization as supporting or creating struggle, and the availability of mental health services and support. When organizations ask those kinds of questions, they can find not only at the population level how they compare with other organizations, but also they can find departments that are hotspots where, similar to how we can find engagement hotspots in organizations, can find mental health support hotspots where people don't feel good. They don't feel like they have the opportunity to do some of the things that Melissa mentioned. And this can be as simple as going to your current provider of survey tools and asking them to add some custom questions for you, or engaging with other types of tools at a large scale. Middle managers or frontline leaders are really key to this work. Almost any strategy an organization has can come apart at the front line. And that also is critical, that frontline leaders believe in the work that's happening, represent it, carry it forward, and act in a manner that builds trust and builds the kind of safety that into the environment that people need in order to be really healthy and to really thrive. And then it does make a big, big difference. That doesn't just take education sessions, computer-based learning or something. Our leaders learn by emulation, and they learn by watching other people who get promoted. So they're watching the senior leader, they're watching their boss, and they're watching the promotion curve in the organization. We recommend really tending to that as people learn really what makes an organization tick.
I'm actually very glad you brought that up. We found the same thing. The supervisor that's actually working with the employees is in one of the most critical positions to recognize that someone's struggling. And when they know how to leverage and be the catalyst at helping people get over some of those barriers and stigma concerns, they can be a tremendous resource at getting people in early. You know, they're the ones that are seeing that they're not showing up to work on time, or they're not working as hard as they normally do, or they just don't maybe seem to be as peppy as they normally are. So it's those frontline supervisors and doing the ongoing training of those supervisors so that they can be a catalyst. The other thing that we have found, I'm glad you brought up the surveying, we've been experimenting and having some good success here in the last year with putting out a well-being tracker. So it's a survey, but it's a very short pulse survey that literally takes no more than 10 seconds to complete. It gets texted out to the population, and they can very easily, by clicking on a happy face or a sad face or somewhere in between, how they're doing in each area of their job, their finances, their emotional or social well-being, their physical or nutritional well-being. They just simply click, 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 and then they can go in and they can see how they're trending, just like you would with a Fitbit or a Garmin. They can see how they've been doing over time. The employer or organization can see through aggregate reports how various departments are doing, who's kind of trending one way or the other. But most importantly, we can see, and because we assign everyone a health coach, that coach can monitor who's struggling and begin to proactively outreach. When people just start going from 4s and 5s, that's kind of 4 and 5 says I'm doing really well. 1 or 2 says I'm not doing so well. And as soon as people start to reflect that, hey, they used to be 4s and 5s and now they're 2s and 3s or 1s, it's like, let's reach out with compassion and simply have them open up. And of course, a health coach, there isn't a stigma associated with a health coach. It's like, let me just share with you what's going on. And we find that a great way to be not necessarily the therapist, but to then get them into the therapy or the mental health experts that they need.
I just wanted to add, just to build on that, agree with everything. And I think having that trusting person that you can be vulnerable with. So just wanting to build on what you both said, whether that's a health coach, your supervisor or manager, it does not need to be a mental health professional. What the literature will tell you is somebody that you trust and that will listen, and you can sit in that space and feel non-judged to really open up. And so I love the different access points that you all have talked about, because not every place can have a mental health clinician, but training people to listen to that story and sit and just be part of their lives to create that early intervention is key.